Yeah, so most of these things, especially if you have issues with constipation, you'll be surprised that you can walk like just a mile, and by the time you get home, your bowels are moving. So let's try and exercise, eat right. You don't have to work out like 30 minutes, 1 hour. Just take like a mile walk, which can be just around this park, and it helps a lot with our system. Thank you so much.
Don't worry, we have a walk. GNA also.
Oh, GNA normally do walk, so we will invite Captain to come and join us. If we are doing 1 hour, you can do 15 minutes or 30 minutes. Thank you so much.
I'm just going to touch base. I think time-wise, we're just going to touch base a little bit of reproductive issues when we get older. The main thing is that, especially I'm going to first start with the women. That's when you start experiencing menopause and all that. In our culture, it tends to be a stigma. People don't want to talk about that. We are shy to talk about it. Please see your doctors of that. Because sometimes somebody may be in menopause for some time and then start bleeding. And then they just keep it to themselves. That can be a sign of so many things, including cancer. Go see your doctor, let them check you out. They may put you on birth control. You'll be amazing. At that age, you may have to be good of that to get that bleeding to stop so that your uterus can relax, and then you can function normally. At some point, they'll take it out. Or if they have to take out your uterus, so be it. It's very important things to take care of before you develop into something cancerous. Also, with the women, one of the things that we experience is, lack of sexual excitement and all that. Please feel free and talk to your physicians about that. Because the issue is that it's breaking families apart. We don't talk about it. We are ashamed to do that. Please talk to your doctors about it. There is so many things that they can help you with. For the men, we go into all kinds of issues. I don't want to name it, sexual dysfunctions and all that. Please don't feel ashamed to talk to your doctors about that. There are normal things that happen with aging. Please talk to your doctors about it. They have things that they can help you with. There's medications. Sometimes it could be just stress by itself. They can help you identify the problem and help you have a healthy life. And then you and your partner can be happy. That is very important. And through that, they can also find out if you have prostate or anything like that. So your yearly physicals, when you go, don't feel shy. Mom will hold it back. When you go, talk to them. That's why you are paying. Talk to them and get the help that you need. Thank you.
Yes, talk to them. So, like Ivana said, the yearly physical is very important. So if you're here and you haven't had one, or if you don't have a primary care physician, please look for one in with your insurance. If you have insurance, it's very easy to call them and for them to find your primary care physician. And if you do your physical, you actually get money. I don't know if you all know that. Some insurance company will actually pay you for getting a physical done. So physical is just like blood work. They'll draw your blood. They'll check all from your from your head to your toe. They'll check your eyes. They'll check, they'll ask if you have any pain anywhere. And I think they also check your urine to make sure that you're not having any infection going on. Kidneys, everything. They do what they call a comprehensive blood work. So that is very important. And for the women, for your physical, like they call it the well women's exam. So you have to also have an OBGYN that you go to do screening, right? So the screening for the women would be breast exam, pap smears, and I believe, yes. So breast exam, pap smear, and then for the men, they also do the prostate exam, which is very important because a lot of younger men now, I think sometimes 45 to 50, are starting to get that cancer, prostate cancer, without realizing. So that's all part of the yearly physical. And then the second thing, recommendation to stay healthy, like everyone has already said, is to exercise. Honestly, if you just move your body 30 minutes a day or for 5 times a week, you'll be good. Moving your body, you can, if you have stairs in your home, you can just do that 15, 20 minutes, you're good. As long as you're increasing your heart rate and you're either using a water bottle or some 2 pounds weight to move, you'll be good. Okay, so that's all about the recommendation. Now we're at questions and answers. Yeah, our table is right there, Ghana Nurses. You can come to it. We have some other flyers for stroke, cardiovascular issues. Okay, thank you.
I think that's it. That's one thing I wanted to add quick when she talked about women. Women, when they get to a certain age, yeah, sexual drive goes down. We become dry. You go to Walmart, there's KY gel. Don't be ashamed to use KY gel. No, it's serious. Don't be ashamed to use KY gel. You get all the different sensitivity or flavors or whatever you need. It's there. It's very important in our Ghanaian community. So KY gel at Walmart, please. We have, if you have any
We can take
questions,
3 questions and then we're done. Anybody has a question?
if you have questions, you can come to our table. We have some resources that we can give to you guys too. Thank you.
Thank you very much.